Hello, hi everyone. We're just waiting for our panelists to join. Oh, hello everyone. Hi, Aisha.
Hello, hello.
So attendees have started trickling in. We'll just wait for other panelists to join. Okay, Dr. Tanya is also here. Hello, hi.
Hi.
Good evening.
3 minutes later, hi again.
Yeah, I see people have started trickling in. So we have like a few attendees now. And just waiting for Martha and then we can start. Hi, Ridita.
Can you hear me clearly?
Yes. Okay, great. So we have hello everyone, and I just want to welcome all the attendees and also our panelists. Thanks for joining Dr. Tanya, Ridita, Martha, and Aisha. I'll take a moment to introduce myself. I'm Purnima. I'm the social media officer at the International Planned Parenthood South Asia Regional Office. IPPF is a global healthcare provider and a leading advocate for sexual and reproductive health and rights for all. In South Asia, we work in 8 countries. So that's Afghanistan, Bangladesh, India, Nepal, Maldives, Sri Lanka, and Bhutan. Um, we work essentially through our member associations and collaborative partners. In September, which is the Sexual Health Awareness Month, we at IPP of South Asia region have been running the Uncensored Health campaign, where we've been talking about our right to sexual health information and services online, free from any kind of censorship. So we believe that information to sexual and reproductive health is a key to realizing our sexual and reproductive rights. In South Asia, where this information is anyway quite restricted, and a lot of cultural taboos exist, we feel that a lot of young people, turn to digital platforms to find essential sexual and reproductive health information. But as we'll explore today, social media platforms like Facebook, Instagram, YouTube, and others are increasingly censoring sexual and reproductive health information, which is limiting people's access to important information on contraception, safe abortion, and comprehensive sexuality education. And obviously, in turn, affecting their ability to make informed decisions about their sexual health. So, I wanted to now take a moment to introduce our panelists. We've brought together a diverse panel of experts and sexual and reproductive health and rights advocates to share their experiences and insights on this issue. How does digital censorship affect our access to essential sexual health information, and what are some ways we can push it? So I'm just sharing my screen so I can introduce you to our panelists in detail. Again, thanks for joining us for the webinar. I wanted to start by introducing Martha Dimitrato, I hope I'm pronouncing that right, who is a digital strategist specializing in sexual and reproductive health and rights. Martha has supported numerous SRHR organizations, including Plan C, Women on Web, Hesperian Health Guides, to name a few. Martha is also active in the digital rights movement. She's contributed to the creation of Repro Uncensored, which is a coalition of SRHR and internet freedom organizations dedicated to combating digital suppression and ensuring the free flow of abortion information online. Also welcoming Aisha Bashir, who is the Communications and Network Manager at the Asia Safe Abortion Partnership. Aisha is an anti-caste feminist activist and has been involved in SRHR work for the past 7 years. An important work of part of Aisha's ongoing work with the Asia Safe Abortion Partnership is the campaign she's leading for the digital safety and data security of abortion and SRHR advocates in Asia, which is called Shaping Safer Online Spaces. So, through SSOS, Aisha has been working to build the capacity of feminist advocates on safely communicating information on SRHR. Also welcoming Dr. Tanya Narendra. A lot of you might know her as Dr. Cutress on Instagram. Dr. Narendra is an internationally trained medical doctor, embryologist, and an award-winning content creator who is passionate about medical education. As a graduate of the prestigious University of Oxford, Dr. Tanya has dedicated her life to public medical education. She's focusing on taboo topics like menstrual health and sex education. Using her social media, Dr. Tanya has also credited with making the HPV vaccine popular in India. And she's currently petitioning the government of India to include it in the national immunization protocol and safeguard the reproductive health of India. Joining us today is also Tasfia Ridita, who is a youth activist working for SRHR and gender rights from Bangladesh. She is the marketing associate at Transcend, which is a youth-led not-for-profit working for the social and economic liberation of the marginalized Hijra, transgender, intersex, and gender diverse community in Bangladesh. Ridita is also a member of the South Asian Regional Youth Network, which is IPPF, South Asia Region's youth network. So I'll stop sharing now and formally say hello to you again. And I was hoping that with this we could start our panel discussion. So my first question was to Dr. Tanya. I was hoping we could start and talk about, your experience as a sexuality educator and how you face digital censorship and suppression of your own SRH content. What have been your experiences like navigating these restrictions online, and how has this impacted your ability to communicate about things like sex and pleasure, which are already so taboo?
Absolutely. It's been a bit of a nightmare, to be honest, in the past couple of years to try to create inclusive sexual health content for people on the internet, with regards to making sure that it is pleasure inclusive, it is also identity inclusive, it is also scientifically accurate, because there is a lot of misinformation that is there on the internet, and I feel like doctors really need to be on this space, and doctors really need to step away. It is a part of it is a part of our public health duty as medical practitioners to be more involved in creating awareness on a large scale for people, especially for young people, in an area that is fraught with stigma that sexual and menstrual health tends to be. And the reason why I chose social media to do this was because it seemed to be a very nice barrier free, uh, easy access resource. But what has happened consequently is that, the barriers have gotten increasingly more frustrating, and it's gotten very difficult over the past couple of years with so much censorship that happens online. It is very difficult to create content on a sensitive topic by making it childlike. Like, one of the strategies I use is to use like things like plushies, or just make it cute. But if I have to talk about breast cancer by using a plushie, it takes away from the gravity of the situation, it takes away from the gravity of the topic. And it is almost you almost have to be a little bit patronizing in the way you talk about it, which is absolutely not how public health is supposed to work, or public health education is supposed to work. So we struggle with creating the right kind of information and the right kind of impact that can be created using, tools like social media, where there's no barrier to entry, where it's easy to access for everybody. There's, the variety in the number of regional languages you can use. But it's really difficult, and you can have things like getting your content flagged for, like, one of my big reels on breast cancer that had like 10 million views got flagged because a nipple was visible, and it was this nipple. It wasn't even a real nipple. So um it is an almost comedic set of challenges we face as educators and as public health activists in the online space.
Thanks, Dr. Tanya. And you are speaking about how it can be so tough for us as advocates to talk about very serious and relevant SRH issues, which is also something Aisha has been working on with ASAP. Um, in South Asia, where abortion is quite restricted and stigmatized already, Aisha, I wanted to know what has been your experience with censorship while you're advocating for safe abortion? And, can you share some examples of what kind of censorship you face when you're trying to bring attention to this issue?
Sure. Thanks. Thanks, Purnima. Thanks for the space. And thank you, Dr. Tanya. I think we all have been following you and love your content. So thanks for all the information that you share. So I'll just share a little bit about ASAP. So ASAP is actually one of the only, I think, regional organizations we are currently working with, our members in 23 countries who is specifically talking about safe abortion within the Asian context and, increasing access to safe abortion services in a dignified way, in a affordable way. So and we have been present on social media for like since its inception. So we've always been there on social media. We have always believed, as Dr. Tanya said, that it is one of the barrier free spaces where we can actually directly connect with a large number of people and share the information that we want to. But recently this was a change that we actually started feeling that in 2020, that was when the pandemic kind of hit. And like all the time, like whenever any crisis kind of hit, we know that SRHR and especially abortion services are the ones to take a back seat. So in online spaces, a lot of information, of course, very relevant COVID related information and all of that was being shared. But we started facing that abortion, our posts containing even the word abortion, any images talking about abortion were if not taken down, they were shadow banned. I mean, we could clearly see the difference in our reach, like of our previous year's post and now in that particular year. So we kind of realized that okay, this is something that we are facing, and we knew that we are not the only ones facing this. So we wanted to connect with organizations similarly who are working on this issue. So we got in touch. We actually created a survey, and I can share the survey with the participants if anybody is interested later on the results of the survey. And it was absolutely, in a way, we knew the results are going to be like this, but still shocking to see that how many of us are facing the same issues with regards to, and the country doesn't even matter. So like we could be in in Asia or in the global north, so to say, and we are all facing the same issues with regards to censorship of by social media platforms. And that's very sad, because abortion in itself is an issue that faces opposition from all angles, right? So one of the things that came out of the survey was that so we had actually respondents from 73 organizations or individuals, and all of them kind of said that abortion is actually one of the topic that receives the most backlash, followed by LGBTQ rights and issues and their sexual health. So that was very interesting. But yeah, so abortion in itself is an issue that faces opposition from all places. And if we have then platforms like Facebook, like big platforms going ahead to censor this information, then where do we go and what do we do? So that's how SSOS kind of came about. We connected with other organization, and we realized that this is an issue that we are kind of facing. What do we do? I do feel that it kind of still puts we wanted to find solutions to it. We realized that okay, this is an issue that we're facing. How do we overcome it? So one of the things that we started doing, and I'll talk a little bit in the later section as well, that we wanted to do was build our own capacity as advocates. Because as when we are sharing information on social media, we are just sharing out of passion. We, even as individuals or as organizations, we believe that this information need to reach as many people as possible. We don't think about digital safety or data safety and security, because we already are dealing with a lot of other issues. So this thought doesn't really come to our mind, and that's totally fair. But with SSOS, we wanted to create this thought leadership. We wanted to bring this conversation up in the Asian context. We already know that in the global north, again in the west, we have seen organizations or groups kind of coming together to create collectives and work towards it. In fact, there are some organizations or groups who are creating their own social media platforms, right? We don't want to do anything with Meta, we are creating our own. So that's great, but we might not have the capacity to do that. And also to acknowledge that in Asia, a lot of people are using Facebook, a lot of people are using Instagram, young people are. So we can't give up on these platforms. So how do we continue using them, but in a way that's, that doesn't put the seeker at risk or at the one who's providing the information at risk? So these were some of the conversations that, that we started having. And we want to, another thing is that we want to create like a space where we can share information, because again, that was also a thing that came out of the survey, that a lot of these organizations were facing these issues and they were dealing with it in their own ways. But how amazing would it be if we could just share that knowledge with each other? Okay, this worked with us, maybe you can try this out. So we felt that that kind of space is something that's lacking, and we wanted to address that. And in terms of censorship, yeah, we have faced, like, for example, I'll share a little bit about a campaign that we did with the Feminism in India. It's a big digital feminist platform in India, and we did a campaign with them on raising awareness about abortion in India. And in India, abortion is, it's liberal, it's, the laws are pretty liberal, it's allowed. It does give a lot of power to the individual in some sense compared to other countries in Asia. So we thought that, it's going to be a smooth process. We're going to talk about things that are already there. But we did started talking about it, and initially, as long as you were sharing definitions and all, it was great. But the moment we started sharing information about how you can self-manage an abortion, so how you can, there are certain pills that are approved by WHO, all of this information is already available. We are not giving it, on our own. And we should have seen the backlash that we got at that time. And they were like, this organization should be shut down, there are murderers. And it's very interesting that that also comes from a very protectionist approach, because they will say that, oh, you are giving this information to women, so they're going to kill themselves, they're going to keep popping pills and they'll kill themselves and all of that. So, in a way, they're looking out for the woman. But of course, we all know that it's just the patriarchal, mindset of not letting women have control over their bodies, or any individual have control over their own bodies. So yeah, I mean, that's just an example of the kind of backlash that we were facing. And we were just constantly telling people that, okay, we are not creating this information, it's already out there, we're just sharing it with as many people as we can. And just one last point I want to add, because Dr. Tanya also kind of touched upon it in terms of the censorship with regards to nipples, or the words that we're using. But at the same time, if there's a male influencer, a big male influencer, who is posting videos or photos objectifying women, or there is a lot of comments or content out there directly targeting LGBTQ community, and members who own their sexuality of the community, and targeting them. So all of that content is always out there. Nobody takes that down, even though we might report it as many times as we can. But so that hypocrisy is also something that, that angers us as advocates. But yeah, I mean, we have to find our way as much as we can. Okay, one last thing. I feel that, it's important for us to build our capacity as individuals as also. But I still feel that it's kind of putting the responsibility on the individual instead of the platforms, who are the big corporates, who are kind of responsible for this. So yeah.
Thanks, Asha. You actually spoken about a lot of things. I'll try and summarize it. So, experience sharing amongst organizations and advocates already sort of working on SRHR and against the digital censorship, and the sort of specific sentimental opposition that people have towards safe abortion. Like, you talk about abortion, and there's just so much backlash that you will get. That's why I want to ask like the next question to Martha, who has specifically been working on these issues. So Martha is a part of Repro and Uncensored, like I mentioned earlier, which is a coalition of SRHR and digital rights organization. So Martha, I wanted to know from you, Aisha said, that Repro Uncensored was formed in response to digital censorship of SRHR information, and for a need to organizations to come together. What insights can you share about the situation of digital censorship in South Asia? Is it the same across geographies from your experience? What have you learned from your partners in the region? Because I see like one of your biggest partners is also Women First Digital, which also works in South Asia and across the globe, of course. So, what have you learned from your partners? How widespread is the problem?
Yeah. Hello, everybody. Thank you so much for having me. Briefly, I'll just backtrack and try to answer your question as as much as I can. I would just echo a little bit what Aisha was saying, that we have been facing, whether this is with Plan C, Women on Web, so many different issues when it comes to big tech censorship, whether it's what you guys mentioned, that it's shadow bans, which are quite hard to be able to really prove, but we know it, to us, but also like to other individuals or like a lot of influencers that we work with. This is an issue. Our Google account with Plan C, or Google Ads account, has been taken down for more than 2 years now. Our TikTok account has been taken down. Women on Web has a constant warning on the Meta account that says that all our accounts are going to be taken down. It's just a constant, I can really go on for a long time, but it's a constant battle with big tech. And as you all said, it's extremely exhausting. It's, we put a lot of resources to create this content or build strategies. And then, they have the power single-handedly and quite arbitrarily to just take down our platforms. It costs a lot of our resources. And I'm not going to go on for a long time, but, like fighting with policy to try to get these things appealed takes a lot of our time. We're small organizations. Our resources would be much better spent in trying to make sure that people have the accurate information that they need, but instead we spend a lot of time trying to appeal these things. It can be very harmful to the end user. We know that, for example, only 80% of people, I think, only click on the first website that they see on Google. So if that's like a fake clinic, that's a massive issue, right? Side note, we did this big research through Repro Uncensored with Women on Web and Plan C that found out that Bing is actually hiding information on accurate self-managed abortion when you spell the words correctly. So there is actually an algorithm that was most likely set up intentionally, while as fake clinics are still often there. And then I would also say that it actually, as perpetuates stigma, right? Because when people have to change the words, or when they see their clothes being taken down, they feel that they're probably doing something wrong, and that's not cool. So that's that, and it takes a lot of our resources. And to your point, we had been seeing that these issues were systematic. It has been happening to a lot of our colleagues. Women First Digital, as you mentioned. Women First Digital and Women on Web are experiencing a lot of what is called Google Core Update. So Google just decides that, hey, you know what, we're going to just update the results on our platforms to reflect what we think is more accurate, which is based on their own criteria, which obviously there's no transparency about. And all of a sudden we see our content being demoted, sometimes to the third or fourth page. These Google Core Updates are extremely hurtful to our organizations. Women on Web serves more than 200 countries worldwide and provides access to safe abortion in an extremely restrictive context. So all of a sudden, when people cannot find their information, that's real people that cannot get the service and the care they deserve. We lost in 2021 about 80% of our traffic, 40% of our consultations because of a core update. So to your point about how this is affecting real people, it really is that they can just be, big tech and people who work for big tech can, be sitting in their offices and just shift algorithms around and just change the fate of so many people. It's extremely alarming. So to your question, we have been seeing that this is systematic and it's happening to all of our organizations. And one of the things we've noticed is that the way that policies are often adapted do not often reflect the legal, political, social landscape of a country, especially outside the US. For example, it has happened to us many times. So we're like Argentina, right? I mean, they legalize abortion, but you can still not advertise on Google. So what I have noticed in Southeast Asia, because we do work a lot in Southeast Asia, is that there is a lot of content that is being taken down. I mean, a lot of our content, our tag page, whatever, all our pages have been affected by it, but also the policies that they often refer to, which again, as we know, are not very transparent, are some kind of blanket policies that have been applied based on some US criteria. And also the people who are trained to respond to us and try to have these conversations do not necessarily receive the education to know what the realities of these countries are. So we have been seeing a lot of censorship, content being taken down, a lot of people have been affected. plus, we know that often the policies do not reflect the reality in this country. So that's also why we created Reprint Censored, because we see that this is systematic. And I don't want to bug you for too long. If you have time, go to reprintcensored.org and have a little bit of a look. And obviously, we'd love to connect with you. Our friends at Amnesty International have been done an amazing work at creating reports on these issues. And Jane Ackland, who's my colleague from Amnesty International, did a great report that just came out on how this suppression is affecting organizations. So one of the things we do is just try to amplify our career research, but also, bring awareness on these issues and work with amazing organizations to create a collective and find ways to circumvent the suppression. One of the ways that I really enjoy working with, and just because it happens, is really try to amplify the work of organizations on the ground, grassroots organizations, just give them the means that they need, whatever that is. It's a conversation, right? We just did two really cool events. One during UNGA in New York, at the sidelines of the UN General Assembly, at the Noy House, with a lot of great artists, including Mujeres al Vendo, which is based in Rio de Janeiro, our friends at Kimpavita, who are based in Senegal, and just trying to amplify their voices. And we just also did a great project in Brussels with an amazing collective in the sidelines of FIAPAC. So yes, that's a long kind of to answer your question, but finding just ways to collaborate and work with actors on the ground and hear their stories, because not everybody has the bandwidth, the capacity, or even, just the resources to have that seat at the table and really discuss this with big tech, I think is very important, and something that we should try to amplify as much as possible. Yeah.
Thanks, Martha. And you're very right. A lot of people in the first place do not have the information that this censorship is taking place, and it's really sort of affecting. You talked about the end user, one of which being young people, right? So I wanted to ask Ridita, as the young people representative on this panel, in South Asia, where access to comprehensive sexuality education is already quite limited, and I know, and we know, data says, and we've seen this as young people ourselves, of when we want to access comprehensive sexuality education, we often reach out or at least rely on digital platforms, right? So how does this censorship affect a young person's access to very essential sexual and reproductive health information? It could be information about contraception, it could be information about your sexuality, your bodies, or safe abortion for that matter.
So much, Purnima, for giving me this opportunity. So let me start by sharing a personal story that I think many of you can relate. Few years ago, a friend of mine reached out to me in desperation, and she was struggling with something personal. He had an encounter where she wasn't sure whether it counted as consent or not. She didn't know how to feel, who to talk, or where to find the answer. Naturally, as we young people do, she turned to social media to seek support and find information. But she quickly hit a wall, because if everything she searched for seemed to be censored, flagged, or taken down. Every post discussing consent was buried under a vague language or misleading terms. She was left confused, alone, and questioning her own experience. I think in this region, young people face significant barrier when it comes to learning about sexual and reproductive health. Cultural taboos, deeply rooted social stigmas, and often restrictive government policies that prevent schools from providing adequate CSE. This means that many young people like me and like my friend turn to online spaces like social media to get the information they desperately need. So when I'm talking about cultural taboos, deeply rooted social stigma, I'm as Purnima mentioned already, I'm from Bangladesh, and as a Muslim majority country, sex education here is a taboo. Even after government has initiated the religious extremist backlash, made the very recently one of these incidents happened where a religious extremist backlash and made the government remove the sex ed part from the book. The biology chapter where basic human anatomy is discussed, including body parts like vagina, vulva, penis, or menstruation like reproduction, that our teachers will often make us, stapler those pages, reinforcing how these are taboo topic and undiscussable. So this kind of censorship, I think, reinforces feelings of shame and stigma. When platform restricts word like rape, abortion, or pleasure, these lacks these lacks of access make young people more vulnerable. I think when we vulnerable to unintended pregnancies, sexually transmitted infections, and about abusive relationships. Without accurate information, they simply don't have the tools to protect themselves or make informed choices about their bodies and relationships. And since you asked about impact, I think it's necessary to talk about the impact on mental health this has on young people as well. There's already significant stigma surrounding conversation about sexuality in South Asia, right? Online spaces like Facebook group often offer anonymity, right? And as a chance for young people to ask questions they wouldn't dare to ask in person. But these conversations are censored or blocked. It can increase feeling of shame, isolation, and even fear to young people like the pressure that it feels pressure and it can lead to mental health challenges like anxiety, depression, and negative body image. And as a woman working for SRHR in Bangladesh and gender rights in Bangladesh, uh, I often find it hard to start conversation with people who are like-minded as me. So I, as a young people, turn to Facebook groups and I'll just start to rant, and then I'll see someone else come and start talking about their experience as well. And this, I will not lie, as works as a therapy and counseling session. But meta censorship often harms this online and safe space. Lastly, I want to talk about the impact it has on advocacy and community building. Online platforms are where young people come together to raise awareness about gender-based violence and sexual health, create poverty, consent, and more. All of these issues are prevalent in Bangladesh. If this platform limit SRHR content, it becomes harder for the youth-led movements and grassroots organizations to reach masses, mobilize for change, or even share basic education resources. And as Purnima already mentioned, I work for Transcend and Breaking Stigma, organization that work for gender-based violence, gender empowerment, and SRHR. I have in my every step, I have felt the need of this conversation that we're doing right.
Thanks, Ridita. You mentioned, social media platforms being very cathartic for young people who are trying to access this information, but also trying to talk about their experiences. One place where I've also seen this, Dr. Tanya, is on your social media accounts, right? You share very critical, essential sexual and reproductive health information. And I oftentimes see young people like me just sort of like coming in your comments, sharing that, I've never found a space where I can openly talk about this. So this is the first time where, I've heard about this. And you've sort of, despite facing censorship, continued to share this information. So from you first, I wanted to know, what are some strategies that you've adopted through which you've tried to navigate the suppression of your content on digital platforms?
Thank you. I really appreciate you saying that because it's very reaffirming when you are in this kind of work that this means something to somebody else as much as it means to me, simply because, like Ridita said, growing up in a pre-internet era for young people, it's very difficult to find that safe space concept that people like Ridita are able to find right now, which we didn't have. And I grew up in a small town, so conversations around our body were not empowering conversations in any way. They were conversations that were filled with shame and stigma. And the way these social media platforms operate, where they force us to use cutesy terms, it reinforces that sense of shame, because apparently there's something shameful in saying the word vagina, but calling it susu is not, or calling it chuchu is not shameful, And these euphemisms have this subliminal, subconscious impact of making it something that needs to be hidden, something that needs to only be addressed via euphemisms. So one of the things that I have done, that personally has been very empowering for me as well, and also for a lot of young people I speak to, is to cutify it, like uh make add positive associations with it instead of using the shame sort of thing. Instead of saying oh shame hai wo, call it things like oh my god, it's the cuterus, or like boobies, using tools like this that make it a little bit more friendly, a little bit more approachable, and that adds some element of almost infantilizing it, but in a positive way. It's very difficult to explain what I'm trying to say with infantilizing it, but in a positive way. But creating empowerment using your language, using words that convey positivity as opposed to words that convey the sense of shame that these social media platforms are trying to pigeonhole us into. I think that has been a really wonderful strategy, because for somebody saying that, my boobies are sagging, but I love them, and like they're saggy but they're mine. Finding that comment from somebody that says that, you know, I love my boobies, I will own my boobies. It is something that creates this sense of self-love, that creates a sense of body positivity. And that is ultimately the aim we're trying to create. We're trying to take away the shame from the lack of sex education that people have, and they've learned to carry in their bodies in some way. And also just using some humor to attack the situation and talk about how difficult it is. Like a lot of my captions talk about, it's so ridiculous that I have to say things like nunu instead of saying penis, and coming up with like increasingly more unhinged terms for talking about an erection. People enjoy that, and I think people learn to find the humor in these heartbreakingly stupid situations. It shouldn't be this way, that people have to come up with euphemisms to talk about their own body. But I think humor has a way of uniting us even in the most unfortunate of circumstances. And I think just adding that element of cutesiness and adding that element of humor has been personally very, very helpful for me, not just in terms of content, but also in terms of feeling empowered in my own body and feeling like I'm owning the fact that we did not have appropriate sex education. But now, even as an adult, as I'm learning more about myself and about my body and discussing it with more and more people, it's still fine. It's still wonderful. Our bodies are still lovely and wonderful and hilarious in their own ways.
That is very nice to hear, and I see like a common thread in your and Martha's response in relying on creative tools and using humor as a strategy to sort of navigate this suppression. Aisha, you work with ASAP, and we do some serious advocacy business there, right? As we people in the NGO sector call it. I was thinking of how you at ASAP have been able to navigate this, right? What are some strategies that you've employed? Because I also know the kind of uh, you know, I would say almost heinous backlash that you guys get for speaking on safe abortion. So, what are
Yeah.
some of your experiences?
Yeah. So, thanks, Purnima. I think, firstly, I think we need to firstly acknowledge that, it's not that we are saying that digital spaces are bad or the social media is bad. So, we need to acknowledge that these tools are not really bad. It's just that they are focused in an extremely patriarchal society. And that is why, the offline biases are kind of reflected in the online spaces as well. So, and just to add to what Tasfia and Dr. Tanya also said about young people using social media, and in today's day and age and going forward as well, Asia is going to be the biggest user of these social media platforms. It still is, but it will is going to massively increase as well. And that's also very interesting to look at the unfair power dynamics, that unfortunately post Roe versus Wade, what happened in the US and the massive restriction on abortion rights that have started happening has somehow reflected and trickled down into the Asian politics as well. And the community guidelines they don't reflect the country's context. I think someone mentioned that as well earlier as well. So yeah, I mean, it is challenging to combat that patriarchy online, to deal with the the censorship platforms, the anti-choice people, the society, and everybody who's kind of sees abortion as this, sinful act that you're doing. But yeah, as Dr. Tanya also said, I think it's using the terminologies, changing the terminologies is one way. So for example, instead of using abortion, we change the spelling a little bit, or use these tactics. I mean, it feels sad a little bit that because the challenge then here is that people who are searching for information online will type the right word, they will type abortion, right? And they might not then get access to the information that we are sharing because we have used a different terminology. So yeah, I mean, these are some challenges that we are facing. But what we are now working towards is that we do recognize the importance of digital spaces also. So we want to continue using them. So we have in fact recently launched an ASAP academy, where we talk about these issues about sexual health, about abortion, technical updates on abortion, on contraception, conception, and on how we can protect our data and our safety online. So using these spaces to is also like in a way that benefits us without putting anyone at risk, is one way that we're looking at it. The other thing is that we so as a so ASAP is like a network, right? So one of the things that we also do is, for example, if we have shared something online and there is someone who comes, who started trolling us, saying that you're murdering people or whatever. So then one of the things that we do is we ask all of our can members, some of who are medical students, some of who are doctors, to kind of come and then troll them like come and then in the comments start sharing that combating that misinformation basically with our evidence based information that we work with, that we share. So somebody who's saying that these pills are killing women, we say no, they're not. We are doctors and we know that they're saving lives actually. And banning abortions is what is killing women, because there's no such thing as banning abortion, right? If there's just safe abortion and unsafe abortion, anybody who wants an abortion will get it. So you might restrict it online, you might take it down from social media, but then they will go to unsafe places where their lives can also be put at risk. So these are some of the things that we are doing. Another thing that we are now working towards and will be looking at is of course building our own capacities as advocates. So we do these workshops with the organizations and advocates, where we try to strengthen their digital spaces and how they're using these the smart devices that we have today, how we're using internet spaces, what are cookies, how do they work. So basic things that we don't really get into because we're already dealing with a lot. So we're having those conversations. But that's again from an individual perspective, that what individuals can do. But also as organizations, as you mentioned, we do work on like extremely serious issues, and it's difficult to continue talking about it. But as you have seen, ASAP, we try to use memes a lot, like so memes. And then meme is a I feel is a content that is very easily relatable with people. Humor works best with people. So if it's getting massively shared by people, that's a great thing. It's being reshared. So instead of not keeping it as serious but still getting our message across. And just coming back to what we can do as organizations, someone as big organizations like IPPF or ASAP, what we can also do is just mapping the information, the communication that is happening within our organizations. So how are we dealing with the data that we are engaging with on an everyday basis? How are we protecting the people who are reaching out to us for abortion information? So for example, one of the things that we do is we do get a lot of abortion requests on Facebook, and from countries like Philippines, where it is extremely restricted. The conversation is not that open. So one of the things that we do is we make sure that we delete the chats, for example. So these are some of the things, and this is like a behavioral change. It is going to be a bit difficult. Just data safety is difficult, and having these conversations is a bit taxing. It's a bit boring. We don't want to get into all this, but I think it is the need of the hour, because the way the digital spaces have exploded since the pandemic, and the mindlessly how we are using all social media and online and internet spaces, is something that we need to take a step back and then see how we're using it, and how our data is being kind of shared online, or how it can be exposed, how it can make vulnerable people even more at risk in countries especially where abortion laws are extremely restricted. So yeah, these are just some of the ways that it's a step forward. So where it's going to be a long journey, and as I said, more importantly, it's going to be a behavioral change. And definitely we want to maybe join Martha in the Repro Uncensored initiative of holding the big techs accountable. I think that's extremely more important. I saw one of their campaigns that we can share and we can just ask questions from these big techs, and that's very important as well, while continuing to manage our own safety as much as we can. So yeah.
Thanks, Aisha. And to everybody who's tuned in, I would actually also recommend you to check out ways you can talk about you experiencing digital censorship with Repro Uncensored, then also think about your larger safety on digital media with Aisha at ASAP. Um, and Aisha, I want to go back to one of the things that you mentioned about language, and that's something Dr. Tanya has also talked about. Is that you would use maybe incorrect spellings, or you would use like different terminology. And I was reading a very interesting sort of research into this, and how digital censorship has sort of almost forced young people to adopt an alternative language. So they'll not say things like suicide or murder or death. They'll use the term unalive, right? This is like
Yeah.
a it's
Hmm.
they start calling it TikTok-ish, this language. Um,
Hmm.
and even when they're talking about sexual and gender-based violence which they might be facing, they
Yeah.
cannot use terms like rape or sexual assault for that matter, right? So I wanted to ask you, Radhita, in this kind of
Just
hyper.
one more thing I want to add, because I think it
Yes,
might be
please.
helpful for people to listening in. One of the things that also works for us and like for other countries that are associated with us on abortion is using regional languages. So
Yes.
English is very easily flagged, but using regional languages, Sinhalese, Hindi, and these languages, again, it you may be able to bypass. And also seekers might be using those language as well. So just wanted to add that. Sorry, yeah.
No, that's actually a great input. This is also largely based on uh, English content that gets flagged. So, Pratita, I wanted to come back and ask you, you see, if you're trying to sort of connect outside of your region as well to people, you are in a very hyper moderated environment. You can't use certain words, but you want to talk about consent, you want to talk about sex, you want to talk about pleasure. So, like, what kind of challenges does this create for young people when they want to talk about their sexual and reproductive health? There's like a hyper moderated environment, and on the other side there's digital censorship. So how do you sort of navigate that?
Thank you again, Nima. So I think Aisha already said that people are very incredibly innovative, and I think young people are more innovative, and they always find a way to communicate using euphemisms, emojis, abbreviation, and code words. For example, instead of directly saying the word sex, they might say sex, SEGGS, or just use the eggplant emoji, creating a form of shorthand that communities understand. And also, as Dr. Tanya mentioned, using humor, so making memes is, I think, what young people mostly do to navigate through these challenges. And then talking in your regional language is also a very big point that Aisha already mentioned. But while these workarounds help, I think they don't come without challenges at all. Besides, it's very unfortunate and funny how policies of these digital platforms are so hypocrite that when there is online bullying going on, if you report it, it might take to days and forever to take action against it. But if there is something going on regarding SRHR, sex or gender based, they take a second to send you warning to remove it. And this is absolutely harmful and hypocritical of this platform, I would say. And as I was saying about the difficulties, uh, beside this, censorship makes vital information very less accessible. I think my other panelists already mentioned it, how this contents get shadow banned and we get very less reach about it. I mean, think about it. If we cannot speak openly about what consent look like, if we're using vague or cryptic language, then how can young people truly understand their rights when it comes to relationship? How can they confidently say yes or no when they're not even clear about the boundaries? Censorship in this sense directly impacts their ability to practice consent. And secondly, I've said this before, increases feeling of shame and stigma when words like rape, sex, or pleasure are treated as they're intentionally wrong or inappropriate, it sends a dangerous message. So what does all this mean? It means that censorship around sexual health topic is doing more harm than good sometimes. While young people are incredibly resourceful, I think, in finding ways to communicate, it shouldn't be a guessing game when it comes to discussing topics such topics as fundamental as consent or pleasure. We need to rethink how digital platform moderate this conversation instead of silencing them. We should encourage safe, open, and inclusive dialogues. We should be empowering young people with language, the tools, the safe spaces they need to explore their sexual and reproductive health with confidence and clarity. And this is where I think digital right intersections with SRHR, and it's high time we talk about it. It's quality health, healthcare related information online is all of our digital and human rights, right? So yeah, and yeah, thank you.
Thanks, Ridita. And I think all of us have spoken about, apart from like our strategies, what is one way to ask for greater accountability, right? Because we can keep strategizing, keep strategizing, keep strategizing. But if the platforms where we exist, where we are talking about, very important sexual health information, want to censor us, they will do that with ambiguous policies, vague sort of clauses in their policies. So I was wondering, Martha, because you have been, I think Repro Uncensored was formed in 2022, and you have been working on this for some time. What are some steps we can take, as users, as also advocates, to ask for greater accountability from digital platforms? And if you have any insights from your partners' work in South Asia, like what is one way to go about it?
Yeah, I was just gonna share actually before, I don't know if that's the best link, but we did this campaign with Repro Uncensored at South by Southwest. I just think it's talking about pressuring big tech when you can have a seat at the table. And we collaborated with this artist, and the idea was to have these mobile billboards and projections through South by Southwest, and they were actually really targeting big tech and saying, okay, you guys can like travel to Austin for South by Southwest, but do you know that there's like a bunch of people that cannot leave the state of Texas right now to have an abortion? Plus, you guys are actually fueling surveillance and just the whole criminalization of abortion with your policies. And I would just say one of the projections and billboards that we had was saying, and you have to scroll, I think, to see it, but it says it's abortion, so well spelled, not abortion, like with a, like a, how to say, like a, misspelled, like whatever, abortion. So yes, just your point about having to find and circumvent ways to go about it. And I was also going to say, before I forget, that with our partners at Women First Digital and Women on Web and Plan C and through Repro Uncensored, we will be launching on International Safe Abortion Day this video. I haven't finished the page or any kind of like strategy yet, but I would love your feedback in this group if you have time. It's like a 5 minutes video on censorship and what the world would look like if we didn't have access to safe and accurate healthcare information. So I'd love for you to just email me like after and just let me know and put my email here if you have any feedback, or also if you want to be part of the campaign. Talking about humor, I hope it's funny. I help with the script. But to your point about how can people support our work, I think that for a long time, or at least I had the impression that, this was, again, like what I said, like first I thought it was an isolated case for some organizations. We realized it's systematic. Then we thought for a long time that this is an organizational issue. It was targeting organizations, and we were thinking of it that way. And then at some point we realized, or it just became apparent to us, how much individuals are being affected. Their accounts are being taken down. They're having, people trolling them and just reporting them. And also, I just want to like give a shout out to influencers. This is their livelihood. And when they get shadow banned and they cannot get the traction they deserve, it's a problem for them, especially because they're trying to, amplify what we do. And it's they're not able to like meet the needs that they meet their needs because of this and the low traction that they receive. Um, and I was gonna say actually that as an example, a year or two ago, Plancy's TikTok account was completely taken down for more than a month. We tried everything. I messaged Amnesty. I went to the press. Obviously, I did a bunch of appeals. I spoke with human rights, and nothing was happening. And then I decided to just share it on TikTok and ask people to just tag TikTok and just amplify this. And in less than 24 hours, we got our account back. So what can people do? Obviously, it's not like a formula. It doesn't work every time, but I truly found the power of coming together and amplifying these things very important. So I think one thing that we can do is amplify, educate. I love what you said about ASAP and how you guys like do this kind of like trainings. I think it's great. Obviously, it's maybe idealized, but it would be great if Reprint Censor and any other organizations and initiatives are not, centralized, but we can kind of like give to people the information they need and then maybe have their own workshops and their own kind of sessions and being able to take this to other spaces. I know that a lot of university students are extremely interested in this. We went to Dakar and we're talking to our partners over there and they're like, oh yeah, actually, I think it's happening to me. I'd love to talk more about this. So I think being able to have like short little toolkits where we can share this and amplifying is very important. Obviously, nepotism always works. So if you have any contacts in big tech, please, sometimes you can be like a friend of a friend, and it's crazy how much we can achieve by just like kind of infiltrating. And then I said it again, but being able to think of creative solutions, like working with creatives on the ground and really supporting local movements. I know it's like easier said than done, but it's really trying to support them, whether this is financially or just like amplifying them and being in communication and hearing their needs, I think is very important. So yeah, that's kind of what I think. Amplifying, educating, raising awareness, and connecting all together.
Thanks, Martha. Speaking of, relying on creative tools, and now I know we're slightly over time, but we have like 5 minutes so we can take questions from the panelists. And there's been like a very active conversation going on here in questions. Somebody's asked, how much does art help? While words can be censored, art cannot be. Any insights on that? And I'm opening the floor to all of you. Please, go ahead and you can answer this. How much does art help?
The question is, how much does art, sorry,
does art help? While words can be censored, art cannot be. So any insights on that?
I'm just gonna speak real quick and say that I find it very helpful because, first of all, even from like a human rights legal, and I'm not a lawyer perspective, it's freedom of speech. It's harder. We did this many times, like with SB8 in Texas and so on. When it's like when we can label this as an art project, I feel like we also have more legal protection, but also, it masks just like a plain message and we get a little bit less suspended. Also, it opens the project up to new audiences. And obviously it's very creative and we would love to work with them. So whether this is directly digital or doing murals or other projects, I've found it very, very helpful.
I have a more cynical answer to this, that art requires conscious engagement. And that is something that is very expensive in terms of digital currency these days. The timelines that people are willing to offer your content are 3 seconds at best. And you cannot send forth a complex, nuanced answer or even a statement in 3 seconds. That, the plethora of content that exists, it is very expensive to find that sort of time that people would be willing to invest in your art. It's a very horrible and cynical answer, but in my experience as a creator, it is a wonderful tool, but it's also a tool for the people who have the luxury of time and who have the luxury of sitting down and engaging with your content and interpreting it in their own way. Whereas what most people want is, here's my problem, here's the answer to it on the social media real estate.
Yeah, just to add to that, I think art is also very subjective. Like, what is art? How do we define art? And but I do think that any sort of creative mediums can be helpful. Like, for example, with regards to breast cancer awareness also, because Instagram was banning female nipples or like showing those images. So there were men, there were these pictures of men nipples being kind of, and I mean that was it still, it carried on for some time. So I think I do think that being creative is it can be one of the ways to go about it, but it is again like it that might be a longer process, as Tanya said, and I think it can be subjective. It might not reach the masses, and they might not get the exact message that we want to. But at this point, I think we'll try anything, like whatever is kind of working. So with that doesn't flag us for being promoting self harm. Like, I mean, talking about abortion is promoting self harm. So yeah.
Try
So,
everything it is. Please go ahead, Ridita.
to add with what Aisha, Martha, Dr. Tanya said, I think as a victim of mindlessly scrolling social media, I can vouch how short our attention span has become. So, in order to understand an art, you need to give it some time,
Yeah.
understand it. So whenever putting arts as a uh, for advocacy, it just becomes less effective because of, I don't know, what I say, because of our mindless scrolling and our little attention span.
Oh, yes, like great art fighting with like the attention economy. So we are against like two big opponents. I know we're like just on time, so I want to take one last question. This is from Surya Rad, who says, "How can other organizations join the Association of Tech and Abortion Rights?" I think the question is to you, Martha and Aisha, is how, like, other organizations who are also advocates of sexual and reproductive health and rights can be part of the ASAP network and be a part of Repro Uncensored. I was hoping you could like share some information about that.
Yeah. Martha, do you want to go first?
Yeah.
Yeah.
I, on anyone can join as long as we're aligned in our values and thoughts and kind of mission. So please just email me, or if you go to reprocessor.org, there is like a contact button, and it will go to us again, and we can just talk and make sure that this makes sense and just give you a little bit more of information on what we've been doing. And yes, there's many organizations that have been working on the space. A lot of them are part of Uncensored, and there I'm sure many, many more that we don't know. And every day is a new discovery of how many people are facing this. But yeah, please message us, and either me or my colleague Jane from Amnesty will get in touch, and we can see what's the best way to move forward.
Yeah. Similarly, I mean, we've, I think, put our email IDs in the chat, so you can definitely, reach out to us. And one of the things that we are working towards also is doing like a risk assessment for organization and individuals. Like, what really is the risk for us, being in these online spaces, and like then based on that, what actions or what strategies can we adopt. So yeah, I mean, there are different ways we can work with, or we work with organizations and individuals, but for now it's more at building our own capacity as advocates, so that we're better prepared for any challenges or any hack or any big issue that we might face in these digital spaces. Yeah.
If I can
Thanks.
also add to that,
Yes,
sorry.
please, Dr. Tanya, please.
There's also something called the Center for Intimacy Justice, which is a collective that works on battling big tech in the censorship that they have been accused of doing, rightfully so. And they have some very nice petitions that also work on similar lines. So I think that's something worth checking out.
Thanks, Dr. Tanya. I think we can't take any more questions because we're slightly over time, but I wanted to thank all of you for joining today and for your very, very important insights, especially for SRHR advocates, SRHR influencers. And before we close, if there's anything that you'd like to say, um, I would just like to give the floor to you as panelists.
Just keep occupying spaces wherever you can, and it's even more important that we are facing backlash. It's even more important that we need to resist and stay on these spaces as much as we can. That's it. Yeah.
I'll just add that when I started creating content about sexual and reproductive health on the internet, there were very few people that were openly talking about it. And I think in the past 4 or 5 years, we've had an explosion of sexual educators online. So it's working. It's a small movement, but it's really encouraging for people like us to see that there's so many people involved. So just use your voice. We have our own personal soapbox that can give us access to millions of people at one time. So just go for it and just talk about how amazing our bodies are and how amazing sex is. That's all. Thank you for having me.
Thank you. Thank you. Very encouraging words. And I would encourage everyone, all attendees, to look at the chat to make sure that you can connect with everyone, every panelist, and explore their body of work.
I was just gonna say, I think obviously it's important to stay in community and just remain curious and see. I personally think how suppression of information is affecting us intersectionally, environment, whatever, war, and so on. And just, yeah, because we're not in silo, obviously, and this is affecting us, many, many missions and causes.
Thank you. Thanks, everyone. Ridita, yes, please go ahead.
Thank you. Just to add shortly, since we are all preaching that we should advocate individually regardless thing, I think it's very important for us to remember that talking about SRHR and gender-based violence is not a privilege, it's our right, and we should all remember this.
Yes. Thank you. That's a great note to close the webinar on. And thank you again to the panelists for joining and the attendees who stayed throughout, asked questions. Please check out our panelists' work, and you can access that through the links in the chat. And thank you again. I will now end the webinar.
Thank you. Thank you so much. Great to learn from all the
Bye.
panelists as well.
Yeah.
Yes.
Thank you.
Thank you. Bye-bye.